Morning. I am Dr. Manasi Naralkar. I am an obstetrician, gynecologist, and infertility specialist practicing in Pune. I would like to thank the admin this opportunity to educate all you lovely women about sustainable menstruation, in particular, the menstrual cup. So, why do you think we need to find alternatives for using pads, that is, sanitary napkins during your menses? The main objective behind this is that as we are, after the plastic ban, and we are facing a lot of issue about waste disposal, especially about the plastics and all the non-biodegradable waste, which ultimately ends up in landfills. There is a need for finding an alternative to women, because if you see on an average that, as gynecologists we always recommend that a woman change her pad once in every 4 to 6 hours, even though it is not completely so by that calculation, considering that a woman gets periods for say around 3 to 5 days on an average, and she would be using around 20 pads per cycle. And if you calculate in a lifetime, if she is getting around 30 years, or 30 to 35 years of periods, she would end up with producing 7,200 used pads in her lifetime. So now actually for one pad to degenerate, it would take around 500 to 800 years. So do you know what that means? That you and I would be long gone. We would be dead, and we would be long gone before our pads that we have used in this lifetime would get degenerated. Which is why we need to really think of other alternatives and get comfortable with using other alternatives to sanitary napkins. Menstrual cup is a very, very good alternative, which a lot of us can easily switch over to. So I would like to start with initially what is a cup. So a cup is something that looks like this. It is a container which is made up of medical grade silicone. It has the capacity to collect your endometrial tissue, your menstrual blood that is shed during your periods, and it is very easy, and it is possible to empty the cup and reuse it. So this cup, it fits inside your vagina snugly, and it collects your menstrual tissue, and then you can always empty it and then reuse it. So how long does a cup last? It can last you for around, on an average, around 5 years. This is made of medical grade silicone. This is the material that we usually use our urinary catheters and all the tubes that we put in the nose and the mouth during our operation. So this is silicone, which is medical grade, and hence it is it doesn't usually cause any allergic reactions when used, because silicone is a biologically inert substance. So how do you use it? So usually you fit it inside your vagina. There are different kinds of folds available. The commonest is the C fold. You pinch it between your fingers and you make a C like this. Alright? And then you fit it inside your vagina. Can you see the fold? Alright? So this is how it goes inside, and it can, when you put it inside, it pops open. So it can, it creates a vacuum seal. You can see these openings, these small holes here, which create a vacuum seal, and it collects your menstrual tissue inside your inside itself. And there is a small stem at the base which you can hold, which helps you to, when you want to remove it and empty it, it helps you to grip it. And then you can, what you have to do while removing, it is not recommended that you pull it by the stem, but you should put your fingers in and you should try to break the vacuum. So when you break the vacuum, it is very easily possible to pull it down, and then you can empty it. You can wash it with normal tap water, clean water, and then reinsert it. So this is what you do when you're using it during your periods. Once you are done with your period, what you do is you immerse it in boiling water, you sterilize it for 8 to 10 minutes, and then store it in a cloth bag ready for use in your next cycle. So this is how a menstrual cup is used. There are different sizes available for a menstrual cup, small, medium and large. How to judge your size is that ideally you should, it's better that you ask your gynecologist to check you once for your vaginal tone. What happens is that once you deliver a child, normally your vaginal muscles, the pelvic floor muscles, they become a bit lax, and that is why you might need a slightly larger size of your cup. Secondly, if you are older, if your body mass index is slightly on the higher side, if you're a bit, on the heavier side, you might need a larger size of the cup. If you're young, if you're less than 30 years, if you haven't born any children, then you can do with a smaller, and of course depending on your flow. So the difference between the small, medium and large cups in terms of the capacity is not very much. It's only around 5 millimeter difference in their circumference and their the diameter of the cup. But it can vary depending on the on your flow. So you might need to opt for a smaller or a larger cup depending on your flow also. If you have a heavier flow, and you are using a smaller cup, you might need to empty it more often. So you might need to switch over to a larger size in the cup. So that is one thing. Secondly, does a cup leak? No, it doesn't usually leak. There are only 3 reasons when your cup can leak. One is that you've not inserted it properly. That is, you haven't really created a good vacuum seal between the cup and your vaginal wall. The second reason could be that the cup is overfull and you haven't emptied it for quite some time, which is when you would really need to empty it and then fit it back again. And the third reason, if a cup is leaking, could be that it is torn or broken somewhere, which is why it is not, containing your menstrual fluid well. If you feel that you need to go to work and you might not get an opportunity to empty your cup very frequently, you can also wear a pad as a backup. So what are the advantages when you switch over to the cup? One is that the most important advantage is that you get rid of all the rashes and the irritation that you get during your periods because of wearing your pads for a very long time. This is the best and the most comfortable cup, the most comfortable reason for switching over to the cup. Secondly, as I said, it is ecologically a very good option because you are doing your bit towards your environment by not creating hazardous waste which is non-biodegradable. Thirdly, it lasts you for quite long. See, if you look at the amount of money that you invest in a cup versus the amount of money that you invest in a pad, you need to, as I said, you need on an average around 18 to 20 pads per cycle. The cost of a cup can vary depending on different brands, somewhere between 350 to 400 to maybe around 850, 900 rupees for the slightly costlier brands. I do not recommend any one brand over the other. They are all equally good. You can choose depending on your comfort and your preference. And a cup can last you for around 5 years. So if you calculate the amount of money that you're spending per pad per cycle, it is quite a good investment that you can do in yourself. Okay, so does the cup cause infection? That is a very common question that I face from a lot of women who are thinking of making the switch. And the second question is that does it stink? No, it does not stink at all. In fact, the smell that you typically get when during your periods, when you're wearing your pads and you change your pad, you get a particular smell. So that smell is because of oxidation of the blood and blood products that are on your pad, which only happens when the blood is exposed to oxygen. And if you put the pad on for a very long time, that is when it usually starts to stink. You would have observed that. Now, if you use a cup and it creates a vacuum seal, the menstrual blood and the contents are not exposed to the external environment. They are not exposed to oxygen, and by the time you change it, it does not stink at all. Trust me, I have been using the cup for quite some time myself, and that is why I can tell you with so much confidence. Of course, medical literature notwithstanding, it is always different when you experience something yourself and then you have first-hand information to tell. So no, it does not stink. Secondly, what about infections? So the cup, as long as you empty it frequently at regular intervals and you clean it well with clean running water and reinsert it, it does not cause infection. What could be the potential reasons for infection? One is that your nails, if they are too long, you might carry some dirt and grime inside your nail, and when you're inserting and withdrawing it, that is when it might either one injure you, and second, it might cause infection if your dirt goes inside your vagina. So that is what you need to really take care of. Secondly, you if you don't sterilize the cup well, if you don't store it well, you need to store it in a cool, dry place away from direct sunlight when you're not using it. After putting it in the cloth bag after sterilizing it, as I said. So if you don't store it well, if you don't sterilize it, that is when it can cause infection, because as you know, blood is a very good source of it can very well, it's a very rich source of nutrients for microorganisms. So microorganisms can grow well in any substance which has blood which is lying around. So your pads, your anything, your even in the hospital we use the gauze pieces and all these things that are blood laden, they have a high risk of being contaminated by microorganisms. So if you sterilize it well, there is a very less chance that it can infect you later on use. Another thing is that is the cup painful? No, it is not painful. In fact, your vaginal mucosa, that is inside your vagina, the mucosa, that is the soft skin, like the skin that you feel on the inner side of your cheek, that is pain insensitive. So within your vagina, once you fit it, you wouldn't even feel it. You wouldn't even know that it is there. However, when can it pain potentially is when you're inserting and removing it, because the external surface, that is what we call the introitus, that is the opening of the vagina, that is what can be pain sensitive. And if you are not accustomed to a woman who is not regularly sexually active, and is not accustomed to inserting something inside her vagina, that is when it can cause a little bit of discomfort and pain. But once you get the hang of it, I'm sure it wouldn't be as painful and as uncomfortable to use it, to insert it and to remove it. All right, so that was about the cup. There are also other alternatives that are available along with the menstrual cup for sustainable menstruation, because there are a few women who are not really comfortable. And also young girls who are not sexually active. If you ask me, do you recommend that these girls also use the cup? I would say it is a personal choice, because we wouldn't, virginity is a very sensitive topic in our society. Of course, the government has taken very welcome measures to ban virginity tests. But of course, if the girl is not comfortable using it, there are other alternatives also available, which include cloth pads and which include also biodegradable pads. The problem with cloth pads are that you really need to wash them carefully and dry them in the sun. I'm sure all of you would have seen the movie Padman, and we know what could be the potential hazards of using cloth which is not completely clean and completely sterile during your periods. Secondly, the biodegradable pads, they are made of things like cotton husk or bamboo husk. They are also a good alternative, but having used them personally, I would say that sometimes the cotton husk inside it tends to get clumped up, and that causes a lot of discomfort. And there are leakages, so you need to be careful about it. Which is why I would still say that the cup is the best alternative if you're comfortable using it. I, for one, would be more than happy to guide you or anyone you would like to recommend the cup to. I would also share the link to one of my blogs, which is about the menstrual cup. If you have any doubts, you please feel free to get back to me, because I would be more than happy to guide you regarding the use of the cup. If you have any doubts, if you're not able,